If you're fully vaccinated, you are protected. You can start doing the things that you stopped doing because of the pandemic.
Hearing from Gary Edwards there, Executive Director of the Salt Lake County Health Department, responding to the new CDC guidelines for wearing a mask. Now, the CDC also recommends that people who have not been vaccinated should continue to wear a mask. We want to welcome you to our In Focus discussion tonight. Welcome to this conversation. You probably have some questions, you have some answers, but there have been so many changes in the last couple of weeks. So we wanted to really sit down some experts, get an update on the state of the pandemic, where are we locally, where are we globally, and what can you expect coming up next. So joining us tonight, Dr. Sankar Swaminathan, Director of Infectious Diseases at University of Utah Health, and then Dr. Stephen Goldstein, Research Associate in Genetics and also a virologist at the U. Thank you both for joining us tonight.
Thanks, Nick.
Yeah, really appreciate you being here. You know, Dr. Swaminathan, the biggest news right now is the new CDC recommendations about mask wearing. If you're vaccinated, you don't have to wear a mask really anywhere unless state or federal rules are in place or the businesses require them. Can you talk about what that means in terms of where are we in the pandemic? Maybe what are you hearing from people as far as some of the questions out there?
Yeah, so I think it's important to focus on what that really means and not to overinterpret it. We, I think, have pretty good evidence that if you're fully vaccinated, that is, the requisite amount of time has passed after the vaccine, that you're very well protected, that you're unlikely to get infected, you're even less likely to get ill and to get seriously ill. And so that's great, but we should remember that that doesn't apply to everybody. A lot of people cannot respond well to vaccines, so I think that's one thing that's been underemphasized, that it's important to remember that if you are immunocompromised in any way, there are a lot of people, children, adults, who have cancer, who have organ transplants, who are on medications that suppress their immune system. They need to continue to be as careful as possible. And really, I'm a little bit concerned that people are going to take this as some sort of license to dispense with all precautions, whether they're vaccinated or not.
Certainly, there's a lot of pent-up demand for life as it was. And a lot of folks were happy to hear about that. And I'm sure in your field, you see some of the possibilities that this could go wrong. Dr. Goldstein, we can get back to that in a second, but can we talk about vaccines? They're approved for emergency use, but studies continue, and you know, what are you hearing from people who say, well, these are just emergency use authorized vaccines? Because there's certainly a lot of critics out there who refuse to get a vaccine because of that. And then obviously there's the science, and maybe you could help us understand what's going on.
Right, so I totally understand people's concerns. You know, they hear emergency use. It sounds like maybe it hasn't been through as rigorous testing as it normally would be for a full licensure. But really what they did is just cut out red tape. Instead of, for example, waiting to find out, is this vaccine good for 2 years, 5 years, 10 years before you need a booster? Okay, it works, let's start and it's safe. Let's start getting it into people, and we'll continue to follow them and see, are they going to need a booster next year? We can do that as we go, instead of finding all of that out before we let people start getting the vaccines, because we're in an emergency. And so it's really important that people understand that in terms of safety and efficacy, you know, corners have not been cut here, and vaccines are our way out of this pandemic and our way back to our normal lives.
And Dr. Swaminathan, the CDC, I mean, it's been a tough time for them because it appeared that they were a political arm, possibly, during the former president. And there's criticism now that this was a political move because maybe they would just lose credibility as folks lived their lives and it felt they were a little bit separate from what they were hearing from the CDC. Can you kind of help us understand what the function of the CDC is when it makes these recommendations?
I think one of the functions is to give the science in a understandable and relevant manner to the public. But they, as you said, are not really in charge of making public health policy. That's up to the state and local health departments for the most part, and the state and local governments. And that's where I come back to what I said before, which is that I believe that what they said is absolutely correct, and it allows people who weren't really sure what they could and couldn't do if they were fully vaccinated and protected. For example, you know, having an indoor gathering with their friends who are also vaccinated is clearly very, very low risk if everyone is vaccinated. So I think it gives people the reassurance that the science is there that tells them what it's safe to do. And it may also be safe for you, if you're fully vaccinated and don't have any other medical problems, to be around people who are not vaccinated. But you see what happens if the mask mandate is just universally lifted. That raises a whole issue of a set of other issues that really don't have anything to do with what the CDC said.
And then you hear some people out there who say the masks don't even work, right? So there's all kinds of things flying at you. So that's why the CDC is so important, to hear the science. And we hear this out in the field all the time when we're covering a COVID story. People like to share their opinions with us, so I hear them. Ultimately, the CDC, Dr. Goldstein, seems to be saying that the vaccines are extremely effective, and so much so that if someone's fully vaccinated, they have almost nothing to fear from the virus. Do you want to comment on that?
Yeah, I think that's generally true. The way I would probably put it is, if you're fully vaccinated, it's very unlikely that you'll get infected, although possible. If you do get infected, though, the likelihood of you becoming seriously ill is vanishingly small. The few cases where we've seen people who are fully vaccinated get very sick or in a few cases die have generally been people who are very old or have other health conditions that made them particularly vulnerable. If you don't fall into one of those categories and you're vaccinated, you are good to go as far as worrying about your own health from this virus.
And Bill Maher, I believe, tested positive, but was asymptomatic, probably a routine test, and he'd been vaccinated, so there's proof there as one of the anecdotal cases. Dr. Swaminathan and Dr. Goldstein, hold that thought if we could. We have more to talk about. We'll be right back after the break.
And my parents are, they are actually scared. They are petrified.
That was a Utahn whose parents live in India, contracting COVID-19. India's medical system is stretched to the brink. It is a stark reminder that this pandemic continues across the globe. Things do appear to be hopeful here in the United States, but there's a lot going on worldwide to talk about. We appreciate you staying with us for our second In Focus discussion tonight on where we are in this COVID-19 pandemic. We're continuing our conversation with Dr. Sankar Swaminathan and Dr. Stephen Goldstein. Again, thanks for being here with us tonight. Let's talk about what's happening globally in regards to the pandemic. Dr. Swaminathan, what's going on in India? What should we be concerned about? What should folks here who may not know much, what should they know? So
I think India is an interesting, although tragic situation. I think there was a perfect storm of bad events. The first is that you had a population that had been lulled into a false sense of security. India, despite its very, very large population, had a very low death rate from the first surge of coronavirus in India. And the government, the Prime Minister, basically went and said, we've defeated COVID, we've shown the world how to do it, and we've won. And what had been probably the most draconian lockdown in the world was completely relaxed. So you went from being very, very cautious to almost no restrictions at all. And then I think three things happened. One is there was a massive religious festival where literally millions of people in the month of April gathered in very, very close quarters with no precautions, and the government encouraged this for their own reasons. And then they had massive political rallies, larger than any that occur in this country, again, with no precautions. And finally, they went ahead and had elections in which I think over 60 million people voted in a very short period of time. So there was just like I said, a perfect storm of things that led to a lot of transmission. And there had been people who were immune from prior infection, but even they may have gotten reinfected because there were all these new variants coming up. We don't know to what extent the variants played a role, but, and then the final thing is almost no one was vaccinated. Despite India being the largest manufacturer of vaccines in the world, less than 3% of its population was vaccinated at the time that this immense surge of infection occurred.
That is fascinating. You think about the waves of huge spreading events there and all the factors involved. I hope that was very informational for a lot of our viewers. So, Dr. Goldstein, the Seychelles, a tiny island nation considered the most vaccinated country on the earth, they are having a spike right now. What do we need to know?
Sure. So, I think what this shows is most vaccinated nation on earth is great. We need to vaccinate as many people as we possibly can. But I think they're around 60% of the population fully vaccinated. That means you still have 40% of your population that is susceptible. And depending on the vaccine that you're using, not all of those 60% may have 100% protection. So if we scale that up to the United States, hopefully we'll get to a point and beyond, but say 60% of people immunized, that would mean we'd still have over 100 million people susceptible to the virus. I don't think anyone would be surprised if in that kind of circumstance you could still have a very large epidemic. I think the Seychelles, unfortunately, is experiencing a smaller version of that scenario right now.
You might know, Dr. Goldstein, a little bit about the Yankees. You're from New York.
I am.
Yeah. They had an outbreak. I mean, 8 of their players got COVID. What are we to make of that? I mean, weren't they vaccinated as well?
Yeah, so I think there's an important distinction to make, is that eight of their players were infected with the virus that causes COVID, SARS coronavirus 2. I don't believe any of them were symptomatic or seriously symptomatic. And so what that's telling us is that the vaccine worked. When these vaccines were tested, they were tested primarily for their ability to prevent illness. They do reduce the risk of becoming infected at all, but people are and do still get infected with this virus. But if you've been vaccinated, the likelihood, which is exactly what we're seeing with the Yankees, is that you're not going to get sick or you'll just get a little bit sick. And so what this says to me is the vaccines are working the way they're supposed to.
And Dr. Swaminathan, we talked about a couple of areas around the globe. Taiwan had been doing really well. I don't want to throw this at you if it's not something that you've been looking a lot at, but I looked at an article that said even Taiwan is starting to have sort of the outbreak spread. Can you talk about that at all, or am I throwing a curveball at you? Sort of late in the game?
I'm not familiar with the details of Taiwan to comment, but I'd like to reinforce what Dr. Goldstein said about the Seychelles, because, we don't know exactly how effective the particular vaccine that they used. It's not a vaccine that we're using in this country or in Western Europe. However, even assuming that those 60% of people were fully vaccinated, 40% were not. And one of the government officials in the Seychelles said that, we are something like we're a fun-loving people, and we, decided to get out and socialize again. And people basically, took no precautions and started celebrating. And I have concerns that any place where we haven't reached a very high level of vaccination and low levels of transmission, that we could have another surge. And, we may be going to talk about this later, but these variants are another sort of wild card. You get variants that decrease the effectiveness of vaccines, so that means that people who have been vaccinated could become more susceptible. And the way that you get variants is if you have replication in unvaccinated people. So basically, unvaccinated populations are a reservoir to breed viruses that will make vaccinated people sick.
A stark reminder for all of us, right? Yeah. All right, so we're going to take another break. Doctors, we appreciate both of you. We'll continue the conversation just ahead.
But we know that whatever could happen in terms of risks of the vaccine, the risk of getting the virus is so much higher, and the risk of having complications of the virus is much higher.
That was Dr. Andrew Pavia from University of Utah Health and Primary Children's Hospital talking about the safety of the vaccine for 12 to 15-year-olds. Welcome to our third and final In Focus discussion tonight on where we are in the pandemic. We're going to continue our discussion now with Dr. Sankar Swaminathan and Dr. Stephen Goldstein. Again, thanks to both of you for being here. Let's talk about herd immunity. Dr. Goldstein, it was and it still is something people like to talk about. It's what we want to reach eventually. The CDC and the Biden administration, they're avoiding the term. They're just talking about getting as many people vaccinated as possible. Can we talk about herd immunity? I mean, is this an actual achievable goal? You know, it's a moving target, I think. First of all, the herd immunity threshold is determined by an equation based on a guess on an estimate. It's not a guess, but it's a scientific estimate of exactly how contagious the virus is. And so we've said maybe it's around 70%, maybe it's more like 80% with the new variants. You know, when you have a vaccine that isn't available to every single person in the population, it's going to be very difficult to reach that threshold, because if the threshold is 75% and you've got a vaccine that's only authorized in 12 and up, you've probably got to vaccinate 85 or 90% of your 12 and up, for example. So I think what we really need to do is every person just needs to take the responsibility on themselves to go out and get vaccinated, both for yourself. You can go do all of the things in your daily life that we've all missed over the last year plus now, and also to protect our communities, protect people who are vulnerable, people who may not respond well to the vaccines, as Dr. Swaminathan mentioned earlier, and kids who can't get vaccinated yet, and hopefully that will change. So, you know, I think herd immunity is a difficult concept to really pin down exactly. We just need to vaccinate as many people as we can. Well, and Dr. Swaminathan, I wonder if you could hop in there. Yeah. What do we know about all kids? I mean, I have a 4- and 5-year-old. I have a lot of curiosity about the efficacy, the safety. How are the studies going, I guess, for kids younger than 12? And let's talk about timelines on possible vaccine availability for them.
So those studies are in progress, and I don't think anyone is really privy to the efficacy data yet. But I think it's reasonable to expect that we should have that within several months, since the studies have begun, and it's really just going to be a question of efficacy and safety signal, which is likely to be similar to that in older children. I'd like to just to make a comment about the herd immunity thing. You know, as Dr. Goldstein said, it's a mathematical construct that's used to study epidemics and outbreaks and so on, and I don't think people should focus too much on that, because there's not some magic percentage of vaccination that we need to reach. I think it is a moving target. There are a lot of wild cards, like I said, but if you have it's based on how many people an infected person might be expected to infect on average. Okay, the so-called R0 or R0, and that is not a fixed number. It depends on the viral strain, but it also depends on whether the people are wearing masks and practicing good hygiene. So if you're not vaccinated, you should be doing what you were doing before, hopefully, because that means that we can reach herd immunity, or effective herd immunity, without getting to that 70 or 80%. It's all interrelated, and so I think it's important to do that, focus on getting as many people vaccinated as possible, bringing vaccine to the people who think they can't afford it, or don't know about it, or can't get off work to get it, and rural populations, disadvantaged populations. The more we can do to make vaccination easy, is the sooner we'll get to useful population immunity, whether we reach a magic number or not. So we have about 30 seconds for either of you. Final question for both doctors. Can I ask what keeps you up at night, as far as what's your worst fear at this stage in the pandemic? My worst fear at this stage of the pandemic is really what's going on worldwide, that we need to get vaccines out, whatever it takes, to as many countries in the world as possible. You know, Dr. Swaminathan mentioned India has only vaccinated 3% of their population. There are over 1 billion people in India who are still dealing with this, billions of people in other places in the world. And, you know, the United States, we're doing great with our vaccination campaign. We're in a position where we can start sending doses to other countries in the world, but we need to help those countries figure out how to make the doses
themselves as well, because this isn't really over anywhere until it's over everywhere.
And Dr. Swaminathan?
So I'm not staying up at night as much as since we've had these vaccines. I'm old enough to remember when polio was rampant and people died from a variety of illnesses that we really don't see anymore, and many people have never seen. Even measles is pretty rare. And we've made strides worldwide as well, and I'm hoping that that's what's going to happen here. And I feel confident that with the progress that we've made, that it's going to continue.
And that is the way to end, on a little bit of hope, hopefully a little bit of confidence. Dr. Sankar Swaminathan, and then Director of Infectious Diseases at the University of Utah, and Dr. Stephen Goldstein, Research Associate in Genetics and, of course, a virologist. Thanks to both of you for being here.
Thank you.